Hello, my name is Paul Jentz, and this presentation is about my personal nursing philosophy. In this presentation, I will be covering the following topics. First, I will give you my personal nursing philosophy, and then I'm going to discuss the things that have influenced how my nursing philosophy came to be. I'm going to talk about my beliefs about people. I'm going to talk about my beliefs about health and our healthcare. And I'm going to discuss things about my beliefs about nursing and our current nursing environment. And then after that, I'm going to discuss my theorist comparison to my philosophy of Lydia E. Hall. Afterwards, I'm going to talk about how my philosophy has changed over the 6 weeks, and then I will talk about how I will apply my philosophy in my future practice. First off, my philosophy is fairly simple and straightforward, and it's never lose sight of the fact that I'm here to do the best I can for each patient I treat, to help them learn about their illness, keep them as pain-free as possible, and to help educate them about living a healthy lifestyle. My influences towards my personal philosophy started with my work experience. I've been in healthcare for over 3 decades. I grew up in a small town called Lannon, and when you were 18, it was kind of expected you join the local volunteer fire department, and I quickly became an EMT there. And after that, I continued being an EMT for some private services in the Milwaukee metropolitan area. And during that time as an EMT, my experience was always shaped with people on a one-on-one during some crisis in their life. It was always an acute illness or acute injury from a car accident or chest pain or trouble breathing, things like that. After I became a nurse, my experience was mostly in the critical care. I had a brief time where I was working on a telemetry floor after I got my nursing license, but then I quickly moved into an ICU, and I've been there for ever since, which is more than 20 years. And during that entire time, we've always had small nurse to patient ratios, usually one nurse to 1 or 2 patients, depending on their acuity. And that has always led me to have a very narrow focus of care on that one specific patient during an acute illness, and not about the global healthcare issues. My beliefs about people: I think that people are all different. We all have different needs. We all have different education levels. We all have different medical knowledge levels that influence those needs. Some people with lots of degrees have very little medical knowledge, and some people with a high school diploma may have a lot of medical knowledge because they have chronic illnesses and have been in the system for years. We need to explain things to our patients in terms that they can all understand. And we also need to know how much they want to know. Some of our patients may or may not want to have a lot of information. Other patients, as we've seen, want to know every little detail about everything that we are doing to them and for them. Our patients have many fears and unrealistic expectations about their disease process, and part of our job is to help them understand what they're going through and what they can honestly expect about how their disease is going to progress. We also need to focus on the bigger picture of these people's illnesses, about how they got to where they are, the things that help, that cause them to have an acute illness, and what they can do after they leave the hospital to prevent them from coming back and can control their illnesses better. We need to assess our patients' understanding of what they understand, and reinforce areas that need clarification. The easiest way I've found over the years to do that is to explain things to patients and then ask them to repeat things back to you in terms that they can understand, to see what they actually do and do not understand. And then that way we also have the ability to fill in those areas that they don't quite understand. And I do think that all patients are able to learn, no matter what their education level. They can all learn more about where they are and what they need to do to make themselves better. And the quote from the Scope of Nursing Practice: "The art of nursing is based on caring and respect for human dignity." This is very true. We need to look at each patient at an individual level. I've said many times in my practice that we're not an assembly line, we're not building cars, things like that. Each patient is different, each person is different, and to show true caring, you need to understand what they are looking for and what they need as individuals. My beliefs about health: I think each person is responsible for their health or healthcare. I've said many years that our healthcare is not a spectator sport. You need to be an active participant in maintaining our health. Um, they have to have some choices that they can make, and we as RNs are able to look at these patients and talk to them and look at their lifestyle choices and help them understand what changes they can make, or what their options are, again in terms they can understand, in order to make better choices. I think we all as people need to watch our diets to some degree. We need to exercise, have regular checkups with physicians and dentists, just to make sure that we are still healthy, or to catch illnesses at an early phase instead of after they become an acute illness. And one of the things that I've done with my patients is try to encourage even small changes in their health. When I see people who will routinely eat a lot of fast food or a lot of soda, things like that, even if we can encourage them to take a little bit less, have one less can of soda a day, or only get a 6-inch sub instead of a foot long, or a piece of fruit instead of a bag of chips, just once or twice a day. Even those little things, getting up and walking around more, maybe going for a walk around the block, all those little things, they're not dramatic, but they all add up and they do make a difference in our healthcare. We also need to encourage regular time off for stress relief. As we know as nurses, stress can add to our patients' illnesses and make them worse. And we as RNs also need to assess our patients' wellness routines and help to educate them about healthy choices. My beliefs about nursing and the nursing environment. Nursing today is very fast-paced in both the inpatient and outpatient settings. And these people that are coming in have many more chronic illnesses to consider when they're there. Our baby boom generation is living longer and longer, and they all have much more chronic illnesses. And we as nurses are being asked to treat more patients, and these patients are sicker and they require more care per patient and a lot more time with education, because when you have multiple chronic illnesses that overlap each other, education is not just about one disease but about multiple diseases, which means that our patient education is now a much bigger part of our caring when we're taking care of our patients. And we all know that nurses were feeling more stressed all the time with the demands placed on our jobs. The theorist I picked was Lydia E. Hall. The reason I picked her is because her theory is very patient-centered, and it's driven by the input from our patients, what they're thinking, what they're feeling, what their wishes are. It's divided into 3 areas of core, care, and cure. The core is the person himself. The care is the intimate bodily care that we as medical professionals deliver to that person. And the cure is the medical interventions we do to them, the medicines, the treatments, the surgeries, those things. And the reason I liked it is because it's very simple, and it's something that's very easy that we can explain to our patients that most people would understand if you were to be able to draw this up on a board for them or a piece of paper. I also like it because it's designed to help nurses develop interpersonal relationships with our patients, and that personal relationship lets our patients feel more at ease and more willing to talk to us about what's going on. At this point is where the nurses can be a true patient advocate for our patients based on the patient's knowledge and what they're truly wishing for their health care. My philosophy has changed in these ways. Originally, it was a very narrow focus of healthcare, trying to help patients through an acute illness. And one of the things that made me change it was this: nursing is the pivotal healthcare profession, highly valued for its specialized knowledge, skill, and caring and improving the health status of the public and ensuring safe, effective, quality care. That section about improving the health status of the public is what made me look differently. Instead of just an individual one-on-one thing, we need to look more globally. And my focus is now expanded beyond just acute illness and that inpatient stay that I normally see my patients for, to expand to include wellness and disease prevention, and expand towards increasing access to resources in the community so our patients can stay healthy and not end up in the hospital. The way that my philosophy is now going to influence my nursing practice, I will find myself spending more time with my patients, evaluating their home situation and pre-hospital support systems. Do they have the physical therapy or the Meals on Wheels or the in-home teaching or care that they need? Are they living in an environment that's appropriate for them based on their physical abilities? We also need to increase education on disease prevention and prevention of readmissions to our hospitals. The simple changes can make a big difference in our patients and whether or not they come back to the hospital. I also feel I'm going to pay more attention to what our profession is doing on a larger scale, both locally and nationally. And I'm going to find ways to help assist our patients find ways to access the health system for preventative services. After I am a BSN, my change in focus is going to come more from a one-on-one direct patient care to a more expansive view of nursing as a whole. I will focus on keeping track of what nursing is doing on a larger scale to expand healthcare to more people, and I believe that I will be more involved in changing our profession for the better on local levels as well as in my unit and hospital with projects for performance improvement, quality improvement, those kind of things that will help shape the future of nursing. Thank you. That's it.